A coroner's court has ruled that the death of a 43-year-old woman is likely related to a COVID-19 booster jab she took just days before. A state coroner says she died from an inflammation of the heart, calling it, quote, a medical misadventure. In December 2021, the late Ontil Charlene Vargas had received her booster shot. The Filipino domestic worker did not show any adverse reaction during the observation period, but she grew unwell the next morning and felt breathless. Her condition worsened 3 days later before she died the next day. The coroner found that she had no family history of heart disease or congenital heart problems. She also did not have any adverse reactions to her previous jabs. This is the second reported coroner's case where a person's death was linked to a COVID-19 vaccine.
For more on Singapore's COVID situation and to help us break down the Arcturus strain is Dr Leong Hoe Nam, an infectious diseases specialist from the Rophi Clinic at Mount Elizabeth Novena Hospital. Dr Leong, it's good to see you again. Dr Leong, the health minister said that...
Yes.
Hello, hi, good to see you again. The health minister actually said that there's no one dominant strain in Singapore, but what do we know about this new strain that's appearing in the ongoing COVID-19 wave?
Indeed, there are actually many strains. Think of them as different racehorses, each one trying to outdo each other. As for the new strain XBB 1.16, what it actually means is one of them is slightly ahead, but this ahead is only about 1.2 times that of the other strains, and hence potentially it may outrun slightly the others. But we're not going to see the kind of Omicron takeover which we saw with Delta, because the advantage is minimal as they try to outrun each other. But what we ought to do is to monitor it closely, because from this XBB 1.16, you could have descendants that could propel it further into something more infectious and spread more easily.
So, Dr. Leong, it's not Arcturus specifically that is of concern, but what may proceed from Arcturus that we need to be looking out for?
Spot on. It actually carries with it two mutations that gives it the advantage to actually infect others more quickly. So could this lead to a new strain, a new adaptation? We don't know, only time will tell.
Dr. Leong, viewers may be concerned about symptoms that they're seeing. There are reports that with Arcturus, we're seeing conjunctivitis as an early symptom of COVID-19. Why specifically conjunctivitis?
I think that's a great question. There are actually two interpretations to it. Number one, we do know COVID-19 does cause conjunctivitis, so this is not a new phenomenon. But is it because the virus has adapted and then hence actually caused more conjunctivitis? That's the first hypothesis. There's a lot of talk on it. Talk as in discussion, but there is no actual scientific publication to back it up. So a lot of talk, but no solid science yet. The second possibility is, I think many people in Singapore have had the red eyes, and this is the epidemic red eyes caused by adenovirus. And we do know when you have COVID-19, you could have other viruses at the same time. Could the red eye be actually due to a concomitant adenovirus from the epidemic red eye together with a COVID-19 in the nose? You see, doctors have a problem. When we do identify one virus, we're happy and label this COVID-19, when in fact the child or the adult may have two viruses, one in the nose with COVID-19, the other in the eye with adenovirus, and hence we have falsely attributed this ability to COVID-19 instead of saying there is a co-infection with another virus.
Dr. Leong, you mentioned, and I suppose this is an extension of your earlier answer. You mentioned the two mutations that define Arcturus. I suppose the concern is always that we might have a variant that is not just much more infectious, but also much more likely to cause disease and also much more severe disease. What sort of mutation might we be looking at, and what are the probabilities of that actually happening?
I'm going to stick my neck out and make a little prediction. At the way the virus is mutating, if it continues this line of mutation, it is unlikely to come up with a more pathogenic, more deadly, more virus that will kill many others. I think that is really unlikely. But what is really unknown, and the greatest fear of every scientist out there who's working on COVID-19, is when the human COVID-19 virus mixes with a coronavirus of animal origin. It's almost like the Asian game of mahjong, where they'll play together, exchange genes, and immediately you have a new 13 genes or 13 tiles of cards, and this will be a totally new COVID, and we could call it COVID-23.
Thanks for all that explanation, Dr. Leong Hoe Nam from the Rophi Clinic at Mount Elizabeth Novena Hospital. Thanks so much for joining us this evening.